A muscle you've probably never thought about could be quietly wrecking your posture and making your spine even stiffer. It's called the hip flexor, and new research shows exactly how it reshapes your pelvis, your lower back, and your entire posture. In the next 6 minutes, we're explaining exactly what hip flexors are and how they connect to spine stiffness and posture. Welcome back to Diabetes Reversal. Today we're connecting a new piece to the puzzle, your hip flexors and how they affect your spine. Hip flexors are a group of muscles, mainly the psoas, iliacus, and rectus femoris, connecting your spine, pelvis, and thigh together.
These muscles lift your thigh with every step, help you climb stairs, and stabilize your pelvis every time you stand up. When hip flexors stay shortened for too long, they pull the front of the pelvis forward and down, a shift called anterior pelvic tilt.
This forward tilt exaggerates the lower back's natural curve, increasing pressure and strain on the lumbar spine with every movement. Physician and researcher Dr. Vladimir Janda described this exact pattern decades ago, naming it lower crossed syndrome. In this pattern, tight hip flexors and lower back muscles overwork, while the glutes and core muscles weaken and switch off. For anyone already dealing with spinal ligament stiffening, tight hip flexors add a second, compounding source of mechanical stress. For many managing diabetes, prolonged sitting and reduced activity keep hip flexors chronically shortened, accelerating this tightening. But there's a deeper biological link too. The same glucose-driven collagen stiffening we've discussed also affects tendons, not just ligaments. Researcher Dr. Arlen Rosenblum helped define this pattern of diabetes-related soft tissue stiffening, now known as limited joint mobility syndrome.
Studies on chronic low back pain found around 10 degrees less hip extension range in affected patients compared to those without pain.
Clinical research found that stretching the hip flexors measurably increased hip extension and reduced anterior pelvic tilt in adults. Together, a stiffening spine and tightening hip flexors pull posture from two directions at once, compounding strain on the lower back. The visible result is a posture with a forward-jutting belly, an arched lower back, and a rounded upper back working against each other. Common symptoms include lower back tightness, a protruding lower abdomen, and a noticeable pulling sensation at the front of the hip. Tight hip flexors also shorten your walking stride, since the thigh can no longer extend fully behind the body with each step.
Over time, everyday tasks like climbing stairs, standing tall, or walking briskly can become noticeably more uncomfortable.
Years of prolonged sitting combined with elevated blood sugar compound this tightening, making it far more pronounced than either factor alone. Clinicians often use a simple hip extension test, known as the Thomas test, to assess hip flexor tightness during an exam. For people managing diabetes with existing spinal stiffness, checking hip flexor flexibility can reveal a second, correctable contributor. The good news is that hip flexor tightness responds well to targeted care, often faster than deeper spinal ligament changes. Consistent blood sugar control remains foundational, reducing new collagen stiffening in both spinal ligaments and hip tendons alike. A simple kneeling lunge stretch, held consistently, directly lengthens the psoas and rectus femoris, easing anterior pelvic pull.
Strengthening the glutes and core muscles helps correct the imbalance, giving the pelvis proper support from the opposite direction. Good. Let's do another one.
Taking short standing or walking breaks every 30 to 60 minutes helps prevent hip flexors from staying shortened all day.
Clinical studies on a technique called PNF stretching found it effectively improves hip flexor flexibility and reduces related low back pain.
Okay, contract your hip now. Okay.
The most effective approach treats the whole chain together, addressing spine stiffness, hip flexor tightness, and core strength as one system. If back pain, hip tightness, or posture changes persist, a physical therapist can build a personalized plan alongside your medical care. That sounds hopeful. We'll work on it together.
To recap, tight hip flexors tilt your pelvis, strain your lower back, and compound existing spine stiffness, but stretching and strength help. Hip flexor tightness and its effect on posture is often one of the most correctable pieces of this whole picture, with consistent effort. Thanks for watching Diabetes 2 Reversals. Subscribe and hit the bell so you never miss the science that could change your life.